Have you heard of the new drug heparin? Word has it that it can fix serious health problems. Do you or a loved one have deep vein thrombosis or a pulmonary embolism? If so, you may be interested in taking heparin. Deep vein thrombosis is a blood clot in your leg, and pulmonary embolism is a blood clot in your lungs. Both are very serious conditions that go along with clotting problems in your blood. Some risk factors for these conditions are age, over 60, lack of movement, pregnancy, birth control pills, smoking, and being overweight. Heparin is a drug that will work fast to dissolve the clot and fix the problem, but it will not keep the problem away, like warfarin will. So, contact your doctor for medication to help with that. Heparin is fast acting, so it should solve the problem fairly quickly. When taking heparin, you will want to make sure you don't take other medications that can thin your blood, like aspirin. Some over the counter drugs containing aspirin, so make sure to check all drugs before taking them. Smoking is also discouraged as it can thin your blood. You shouldn't take heparin unless prescribed by a doctor.
You may experience these side effects when you're going on heparin. The most common side effects of heparin is bleeding, which can lead to hemorrhage in any site of the body. The signs and symptoms of bleeding are bleeding gums, tarry stool, coffee ground, emesis, and easy bruising. Thrombocytopenia, which is low platelets, is the second common side effects of heparin. Also, heparin may reduce bone mineral density with prolonged use, more than 6 months. Abdominal pain, stomach pain, swelling, and constipation also can be side effects of heparin. You want to avoid abruptly stopping taking heparin as it may cause increased coagulability. Warfarin therapy usually overlaps heparin therapy for constipation or of prophylaxis of treatment. So please contact your doctor before stopping heparin.
If you experience any of these symptoms, please call your doctor immediately. Changes in mental status, headache, and any unusual bleeding or bruising, report immediately to a physician. This includes things like red or black vomit or feces and blood in the urine. Other less serious symptoms you may experience are bleeding in the gums, hematoma, anemia, thrombocytopenia, and rash. You want to check your skin for bruising regularly throughout the heparin treatment.
Heparin is usually administered via IV injection or infusion. There is also a lower dose form that can be injected subcutaneously, which could be in your belly or arm. Remember, when taking heparin, that is important to get a baseline APTT before starting therapy and check it every 4 hours over the duration of the therapy. It is important to get the results of a coagulation test at least 30 minutes before administering the next dose, as this test may indicate adjusting the dosage. Monitor hematocrit and platelet count and keep an eye out for any signs of bleeding. Remember, it's important to tell your doctor if you have any of the mentioned signs above. Keep some protamine sulfate on hand in the event of signs of heparin toxicity. Those signs are bleeding, nosebleeds, hematuria, melena, easy bruising, and petechiae formations.
Contact your doctor today about starting your heparin therapy.